Aging is a natural process, and while it comes with wisdom and experience, it also brings challenges, particularly to our skin. Skin, the largest organ of the human body, serves as a protective barrier, regulates temperature, and allows sensory perception. However, as we age, it undergoes a myriad of changes, making it more susceptible to various conditions. In this comprehensive discussion, we will explore common skin problems affecting older adults, supported by scientific evidence, real-life scenarios, and valuable insights to help mitigate these issues. The aging skin. A story of resilience and challenge. Imagine Margaret, a 72-year-old retired teacher who has always taken pride in her radiant skin. However, over the years, she noticed changes, wrinkles, sagging, dryness, and pigmentation. She consulted dermatologists, read research papers, and adapted her skincare routine. Her journey is not unique. Millions of elderly individuals face similar issues. Understanding the underlying science can help us navigate these changes effectively. Wrinkles and fine lines. The marks of time. Wrinkles are one of the most noticeable signs of aging, and they occur due to intrinsic, natural aging, and extrinsic, environmental factors. Collagen and elastin, proteins that maintain skin structure and elasticity, diminish over time. Scientific insight. A study published in the Journal of Dermatological Science highlights that after the age of 20, collagen production decreases by approximately 1% per year. UV radiation accelerates the breakdown of collagen through oxidative stress and inflammation. Repeated facial expressions cause dynamic wrinkles, which eventually become static as skin loses elasticity. Prevention and management. Retinoids, vitamin A derivatives, promote collagen synthesis. Antioxidants like vitamin C and E neutralize free radicals. Sun protection is crucial. Broad-spectrum sunscreens prevent photodamage. Xerosis, dry skin. The battle with hydration. Margaret often complained about itchy, flaky skin, a classic sign of xerosis. Older adults experience this condition due to reduced sebum production, hormonal changes, and impaired skin barrier function. Scientific insight. Research from the American Journal of Clinical Dermatology reveals that lipid content in the skin decreases with age, contributing to transepidermal water loss, TEWL. Conditions like diabetes and hypothyroidism can exacerbate dryness. Certain medications, such as diuretics and retinoids, contribute to xerosis. Prevention and management. Use of ceramide-rich moisturizers to restore the skin barrier. Hydration through increased water intake and humidifiers. Avoiding harsh soaps and hot water baths, which strip natural oils. Age spots and hyperpigmentation. The silent accumulators over the years. Margaret noticed dark spots on her hands and face. These age spots, also known as liver spots or solar lentigines, result from prolonged UV exposure and melanocyte activity. Scientific insight. Melanin production increases as a protective response to UV damage. A study in dermatology research and practice suggests that oxidative stress and inflammation play crucial roles in hyperpigmentation. Hormonal changes and genetic predisposition also contribute. Prevention and management. Regular use of SPF 30+ sunscreen. Topical treatments such as hydroquinone, kojic acid, and niacinamide. Laser therapy and chemical peels for stubborn pigmentation. Skin cancer. The hidden threat among aging individuals, skin cancer is a significant concern, particularly in those with extensive sun exposure. Margaret's friend, John, was diagnosed with basal cell carcinoma, the most common form of skin cancer. Scientific insight. UV radiation induces DNA damage, leading to mutations in tumor suppressor genes. A study in the Journal of Investigative Dermatology found that individuals over 60 have a higher prevalence of actinic keratosis, a precursor to squamous cell carcinoma. Fair-skinned individuals with a history of sunburns are at increased risk. Prevention and management. Regular dermatological checkups for early detection. Wearing protective clothing and seeking shade. Surgical excision, cryotherapy, and topical chemotherapy for treatment. Pressure ulcers and bed sores. The immobility challenge. Margaret's bedridden uncle developed pressure ulcers due to prolonged immobility. These painful wounds result from continuous pressure, reducing blood supply to the affected area. Scientific insight. Reduced collagen production and poor circulation increase susceptibility. The Journal of Wound Care states that individuals with diabetes and vascular diseases have a higher risk. The Braden scale is a validated tool for assessing pressure ulcer risk. Prevention and management. Frequent repositioning of bedridden patients. Use of pressure-relieving mattresses. Adequate nutrition with protein, zinc, and vitamin C for wound healing. Eczema and dermatitis. The itchy intruder. Many older adults experience dermatitis, often mistaken for an allergy. It manifests as red, scaly, and itchy skin, commonly affecting the legs and arms. Scientific insight. The National Eczema Association states that skin barrier dysfunction and immune dysregulation contribute to eczema. Contact dermatitis in the elderly is often due to irritants such as soaps, fragrances, and fabrics. Prevention and management. Avoiding known triggers and allergens. Topical steroids and calcineurin inhibitors for inflammation. Moisturization with fragrance-free emollients. Fungal and bacterial infections. The microbial invasion. Older adults are prone to fungal infections like athlete's foot, candidiasis, and bacterial infections due to reduced immune function and compromised skin integrity. Scientific insight. The Journal of Clinical Microbiology reports that Trichophyton rubrum is the most common dermatophyte in elderly patients. Factors like diabetes, obesity, and prolonged antibiotic use increase susceptibility. Prevention and management. Keeping skin dry and clean, especially in skin folds. Antifungal creams and oral medications for severe cases. Proper wound care to prevent bacterial superinfection. Conclusion. Aging with healthy skin. Margaret's journey taught her that aging skin requires proactive care. Science-backed strategies like sun protection, hydration, early intervention, and medical consultation can significantly improve skin health in older adults. Understanding these common conditions empowers individuals to embrace aging gracefully while minimizing discomfort and health risks. Healthy skin is not just about appearance. It's about maintaining quality of life, comfort, and confidence. The more we invest in skin health today, the better we age tomorrow.